So good evening to everyone. We've got a good turnout, which is always exciting to see. Thank you so much for joining us. Again, just a reminder, if there are questions, please add them to the chat at the bottom. I'll moderate those when we go into the live demonstration. I'm going to be hosting the event this evening. My name's Chris Stock, the Customer Success VP for MD360 and the CEO of Sales MD. So I'm going to sort of hopefully pull this all together as we go through. And just a reminder, any questions, add them and I'll moderate them. So let's kick off. I'd like to initially hand over to Elijah Wheeler. He's the CEO and founder of MD360, and he's the coordinator who's pulled this event together with his team. So Elijah, over to you, please.
Hey, thanks so much, Chris. It's good to be with everybody tonight. It's nice to see, looking at the roster right now, it's good to see some familiar faces and some of the country's most brightest surgeons. This is really great, and some great spot owners as well. Really excited to have you guys. Again, my name is Elijah Wheeler. I am the CEO. Not a big fan of that title, but I'll accept it. But I am a proud family member of MD360. Listen, I know it's been quite chaotic this year, and at times it doesn't always feel quite like a celebration, but please don't let that rob you of your joy. There's more to life than what you're seeing on the news and what we're reading on social media every day. Before you know it, it'll be the new year, and we'll look back on 2020 as a blip on just the radar. At MD360, we're proud to be home to some of the most brightest and strongest R&D departments in the world. It's our mission to always be on the forefront of what's happening globally and to provide best-in-class technology that will have the sort of impact in your practice or spa that can be life-changing to the owner and to the patient. Tonight, we have a unique privilege to learn a bit more about LIPOcel, the aesthetic industry's first pain-free HIFU body contouring platform. It's not only minimal in pain, but listen, it's one of the only technologies in its class to receive clearance for permanent fat destruction, which is quite telling. For the last 3 years, LIPOcel has quickly become the most sought-after non-invasive body contouring solution in Australia, South Korea, Europe, and even China. With that sort of trend and traction, we can all assume that the US is probably next. We're excited to be the face of this product and look forward to its impact in practices across the US in the next year and years beyond. I don't want to give much more away, so I'll be happy to hand this back to Chris. Enjoy the presentation and your time with our fine friend, Dr. Michael Ellis.
So thank you, Elijah, for that. So I thought I'd show my face now. As I say, I'm going to moderate this. So I'm the VP of Customer Success for the MD Power Program. I'm going to talk a little bit more about that later in terms of what that is and how that differentiates MD360. But what I want to do is just jump straight into introducing Dr. Mike. Before I do, now, we're going to have Dr. Mike doing a demo and the slide deck. And just a bit of housekeeping, as I call it, there's a bar across the middle. I know that sounds silly. We try to sort of automate this, but there's a bar sort of about a third of the way down. With 3 little dots in, or 3 little lines. You can pull the bar down, so therefore you can see half the screen on Dr. Mike doing the demo and half the screen on the slide deck. So that just gives you a little bit better visibility. Otherwise, the slides can sort of overpower the demo, and I wouldn't want that. So again, reminder, if you've got questions, put them into the chat room. I'll moderate that as we go through. So let's jump straight in and get Dr. Mike doing what he's best at. So Dr. Mike is the owner and medical director for Keep Glowing Medical Spa in Tinton Falls in New Jersey, and is one of the first practices to join the MD360 Power Program. There you are, Dr. Mike, looking fantastic, if I may say so. So he completed his residency of internal medicine and has experience in hospital-based medicine, internal medicine, and healthcare administration, serving on the board of Doctors for Advancing Health Quality Alliance of Richmond. After working in the front lines during the peak of COVID, he's shifted his focus to aesthetics and wellness practices. So welcome, Dr. Mike Ellis. I'd like to hand over to you.
Thank you, Chris, for the introduction. Thanks, Elijah, for having me. Welcome, everybody. I've really been looking forward to tonight's event. I'm going to be showing you basically firsthand how the LIPOcel device works. I'm going to go into a little bit of the technology, a little bit of the science behind it, how I gauge my treatments, how I monitor my treatments. I have Liz here with me, who is going to be my model for the night. We took some before pictures, some measurements as well, and then through the treatment at the end, we will take some after pictures and we'll do a side-by-side comparison so you can see the amazing results that you get immediately. Like I said, and like Chris said, if anybody has any questions, feel free to put them in the bottom. I'll be happy to answer them along the way. I'm going to be using another camera to do the actual treatment. So if you guys want a close-up of anything, and just let Chris know, he could stop me. I could always move the camera around. Don't worry, I will be going through a slide that adjusts all the options on the screen. So don't worry about getting a close-up on that. So without further ado, I'm going to switch the camera over and get started with the treatment.
Dr. Mike, just quickly, you talked about taking some before shots. We're obviously going to take some after shots. What about the measurements?
So measurements, I took 2 measurements, one at the level of the navel and then one right at the base of the rib cage. The navel was 75 centimeters and the below the rib cage was 78 centimeters.
Perfect.
So we can compare those at the end as well, so we'll take other measurements on our pictures. So as I get set up here, like Chris said, I kind of started this all after COVID, after working on the front lines and getting sick of dealing with patients dying and me having no control over it. I have a ton of technology here. I have a total of 8 machines, including lasers, body contouring devices, CO2 devices. So I have a little bit of everything. So this is actually the last device I added to my arsenal, but it is by far one of my favorite ones, mainly because of the results you see and how well it works. And you'll get to see firsthand the results that you get and how well it really works. And once again, any questions, let us know. Liz is happy to answer any questions if you have any for her. So without further ado, we'll get started and we'll start getting some information to you guys as well. So one of the main questions I usually get from people, clients, other doctors is, how does this device work? So this device is working by high frequency ultrasound. The device itself causes coagulative thermonecrosis, basically meaning that below the skin in the area that we're treating, the focal point, it's heating that fat tissue up to about 160 degrees Fahrenheit or 70 degrees Celsius. But at the surface, the device is performing contact cooling, which is actually patented by the LIPOcel device. Contact cooling cools the surface to about 5 degrees Celsius or 40 degrees Fahrenheit. The benefit of that is that it allows us to deliver more energy to the patient's skin and fat without causing any damage to the skin and without causing any pain. This treatment focuses right on the subcutaneous tissue. The adipose tissue, there's no effect on visceral fat. So that's one of the contraindications that we'll cover later is your BMI and visceral fat. But HIFU technology, it's actually been used since the 1990s. It was originally used for cancer treatments and benign tumors such as fibroids. Basically what it does is it works on 2 mechanisms. It ablates the tissue, the adipose tissue in this case, and it also causes mechanical destruction. So the mechanical destruction occurs through the treatment with the introduction of the sound waves. It causes disruption of the cell membranes and causes destruction of the actual adipose tissue. The heat is later delivered and it causes additional damage to the adipose tissue as well as some of the surrounding adipose tissue, but while leaving most of the other tissues unharmed, such as your skin and your muscle. So the machine causes immediate cell death because of the breakdown of the cell membrane as well as heat that is delivered. This immediate cell death causes the wound healing cascade. It attracts the macrophages and all the inflammatory cells. So with the immediate cell death, you start to see immediate changes right after the treatment. Over the next roughly 12 to 18 weeks, the macrophages continue to go into the body. They remove the lipids as well as all the cell debris from the treatment area. The inflammatory cells also follow, and they also bring in some of the collagen cells that were denatured by the thermal damage. They cause fibroblast activation, and the result is new collagen formation, tightening of the septal fibers, and skin tightening. So this machine is causing both skin tightening as well as adipose reduction. So the treatment areas, this machine can essentially treat anywhere from the neck down. You need roughly 1 centimeter of fat beyond the 1.3 centimeter focal point. So your focal points, you want to have a little bit of cushion behind, because like I said, it doesn't just work at the focal point, it works a little bit beyond each area. But your most common areas you're going to treat are going to be your abdomen, your thighs, your glutes. You could go with calves, your bra rolls, love handles, and your arms. There right now is one FDA approved handpiece, which is the one we're using right now. It is a 13 millimeter focal point. It's a 30 by 30 millimeter working area. There's 2 other handpieces that are in the works to get FDA approved right now. One is 11 millimeters and the other one is 8 millimeters. That's a focal point. The benefit of having these other focal points is it allows you to treat more of a superficial area. So like I said, with the 13 millimeter, you want an inch of pinchable fat in the treatment area. You also don't want to treat unless there is an inch of fat overlying any bone or any areas of collection of nervous tissue. With the 11 millimeter focal handpiece that will be coming out, you only need 2 centimeters of pinchable fat, and with the 8 millimeter, you'll need 1.5 centimeters of pinchable fat. This gives you the benefit of treating additional areas for people who want to treat over the ribs or different parts of the arms, maybe over the knees. Also gives you the benefit of being able to treat people as they start to reduce fat and have less fat in the area, because you don't want to be treating against the bone. So the other great thing about this device, about this treatment, is that there are relatively few contraindications. Your main focus with contraindications is you want to make sure you have at least 1 inch of pinchable fat. Once again, you don't want to be treating over bone that has less than 1 inch of fat over it. You don't want to be treating over any areas with collections of nervous tissue, and you don't want to be treating over any areas with open wounds, active skin disorders, skin infections. Any mechanical implants in the area have not been tested, but you don't want to treat those because once again, you're heating up the skin. So in this case, if you're treating an abdomen, you want to avoid a patient who might have a hip replacement, because it could heat up that hardware and cause some internal damage. Other contraindications are your pregnant women, people who have any type of permanent implant, such as a pacemaker or cardiac stents. We just don't know if there's going to be any interference, so we say just stay away from those completely. Your relative contraindications are going to be your patients with bleeding disorders, those who are on anticoagulation, or history of skin cancer. Those are at your discretion, and dependent on the area that you're treating, you may be able to kind of bypass those. The big thing is you always want to perform your history and evaluation. Your disorders that you kind of want to keep on your radar but aren't going to be absolute rule-outs are your diabetic patients who are poorly controlled, patients with fluctuating blood pressures, clients who are breastfeeding, autoimmune disease, or those who are immunocompromised due to steroids or immunotherapies.
So Dr. Mike, this is phenomenal information, and that just taking a different tack right now. How's the model feeling? How is it from her side?
It's not painful. Definitely not painful at all. I feel a little bit of coldness sometimes, and then I feel a little bit of heat, but neither are painful or uncomfortable at all.
Fantastic. And is this a sort of a treatment that you would recommend to sort of your friends and colleagues?
Yes, if it works, I'll recommend it to everyone.
Excellent. Okay, back to you, Dr. Mike.
So with any treatment, you do want to be concerned about any adverse reactions, adverse effects of the treatment. Your most common adverse effect is going to be erythema, and that's going to be from your contact cooling. So that's going to last, a couple minutes, maybe an hour tops. Just irritation of the skin from being pressed on and from the cooling. Nothing long term. One thing you do have to look for, if you watch what I'm doing, is I keep spraying the area with distilled water. How I like to do my treatments, I like to spray the entire abdomen once at the start, and then each treatment area, I make sure it's moist. This is basically making sure you have good contact with the skin and that you're getting good transmission through the skin and you're not causing any damage to the superficial layers of the skin. Other rare adverse effects you could have is bruising and edema, which could last up to 1 week. I actually have not seen it in any of my clients as of yet. No one has had any side effects at all. Everyone has been, back to normal before they even walk out of the office. After I finish the skin, I'm actually going to show you guys. She does have a little bit of erythema just from the cold, but it's nothing significant. So you see there's just a tiny bit of erythema around, but nothing that's really troublesome. You can see it's just in the area from where I had the machine pressed onto her, and that will likely be gone by the time we take pictures at the end. So my treatment screen. Treatment screen is very, very simple to use, very simple to understand. Your number 1 at the bottom, this is describing which tip you have. Like I said, there's going to be different tips coming out in the next couple of hopefully months, just to make sure everything is functioning properly. And I'll identify the L13 tip is the one that's 13 millimeters. The other ones will say 11 and 8. Number 2 on there is your ready and standby buttons. The screen that you see on the PowerPoint, the machine is in standby. It's lit up in green. On my screen, the ready button is lit up in blue. That means that I'm actively doing the treatment. My number 3 on there is my remaining cartridges shots and my current shots. The remaining shots on the cartridge is exactly what it sounds like. Each cartridge, depending on which one you choose, is rated for about 3,000 shots or scans, however you want to identify it. And it counts down from 3,000 with each scan you do. And then the current shot is how many shots you've done during this treatment. So I've done about half of her abdomen. I've done 15 shots so far. Number 4 on here is that black bar that you see. That black bar is actually your timer of how far along the scan is. So that bar will light up orange, kind of like any other loading bar, as you're done. When the scan is complete, the entire bar will be orange. When you move to the next area and hit the button again, it'll turn black again and the orange bar will continue to grow. Number 5 on there is just your selector arrows. So up and down to choose your stack time and your level. So 7 and 8 are your stack times and levels. What you do to change these, if I wanted to change my stack time, I would hit the stack time button and then use the arrows to adjust. What a stack is it will deliver multiple scans with one press of the button. So for example, I've been doing 1 stack. If I change over now to 2 stacks, I place in one area, we'll go through 2 full scans without having to lift or push the button again. You could set it for up to 5 stacks, so 5 scans with 1 push of the button. I haven't gone that far. The highest I have gone is 2 because it does deliver a significant amount of more energy, and I haven't actually had anybody who's had to need that much energy to get any type of results. Your level is the T in the box that you see. Same thing, if you want to change your level, you hit the button and you select your up and down arrows to select the level. The level is basically measured in joules per centimeter. I don't have the exact figures, but you have 12 levels to choose from. Your next setting is your S and V mode. S mode is your mode that you're going to use most commonly. It's your standard mode. This delivers the same amount of energy with each scan. If they're stacking form, that keeps that energy the same each time. V stands for VAS, or after the VAS or VAS pain scale. What this does, it reduces each subsequent scan by roughly 5%. So clients who are uncomfortable, who are feeling pain with later scans, you can always make it a little bit easier, but still go for those better results. And then lastly, up top is your settings and service buttons. That is just if you need to change a couple of the settings, if you want to change your V settings to what your levels of drop are going to be. Once again, that's something you're really not going to need at any point. One other thing I do like to point out is if you're treating over bone or if the machine gets lifted up a little bit, you are going to have some discomfort from the patient. But the benefit is you don't have to do anything, move anything to actually stop the scan. If I hit the same button that I used to start the scan here on the probe, it immediately stops the scan where it is. and it also puts the machine back into standby mode. So no matter how many times I push it, it won't start scanning again. So it's a great safety precaution. If somebody's uncomfortable, if they're moving around, if something slips, I can stop it without having to move anything, and it doesn't let me restart it in case I accidentally bump the button again. To go back to treatment, I hit the ready button again. It resets back to the area where it should be to start, and I can just start again as usual. So a couple of one other adverse.
I've got a question coming in. So let me just mention. So I've got a question coming in. How does this differ from my English is bad at times. Sign on. I can't even pronounce it. Syneron Candela Ultra Pulse Power. So how does it differ from that? And so the answer, the power in both technologies are ultrasound, but the applications are actually quite different. LIPOcel is 2 times the delivered energy with a max energy of 100 joules compared to UltraShape's 50. What really separates the two is actually the contact cooling. It's not that UltraShape didn't work. It does, but it's not always a tolerable, which can lead to a lack of efficiency and efficacy due to incomplete treatments. So hopefully that sort of gives a little bit of an answer there. So back to you, Dr. Ellis.
So one important thing I do want to point out with the emergency stop button is the reason this is important is because you do not want to lose contact with the skin at any point. You have to remember, you're only working with 13 millimeters from where your probe is to where your focal point is. So if somebody starts to move, jumps off the table, you're going to move that focal point more superficially towards the skin. If it gets to the level of skin, it could cause up to a 2nd degree burn, a lot of pain, and then you have all the burn aftercare you have to worry about. So that's why I always tell people, if something's uncomfortable, tell me right away. I can stop it because I don't want them moving around, anything slipping or sliding off of them. So that's one of the big things you do have to remember. So my treatment protocol.
Dr. Mike, a question coming in for you. What pre-treatment medication or topical treatment did the model receive at the start of this?
None. Actually, the only thing I do is I just clean the abdomen with either some alcohol or cleaning solution just to wipe off any type of lotions or creams that might be on there. There is no aftercare, pre-care that's really that necessary. I have spoke to one person in the past who was using a lidocaine solution and injecting it under the skin, kind of like when they do liposuction, and he was able to deliver more energy, with more stacks. But from what I understand, he didn't really get a significant change in results. So for me, that's just adding more chance of adverse effects, side effects by adding a medication that's not really needed. But my pre-care is just, making sure I have my measurements, my photos, and then just cleansing the skin to get any lotions and creams off.
Excellent. So and for an average abdomen, how many lines are you using per treatment?
So average size abdomen, I'm using roughly 20 to 30 scans. So each scan takes roughly 50, 55 seconds if you time it out. So you're talking 20, 30 minutes of treatment total. If you're doing a stack, then you're doing twice as many scans, so you're doubling your time with each scan. But you'll kind of learn to kind of play with it a little bit and work on the areas. That brings me into my treatment protocols. Like I said before, my important things to do beforehand, besides cleansing the skin, is your measurements, photos, and weight. Your measurements are going to be what you use to track, see the progress. It's also going to show your before and after losses. Your photos are great just to show the patient, the client, what type of changes they're seeing in their body. And it's also great to keep track because you'll see, changes, in the weeks that they are not coming to see you, you'll see a change between those 3 to 6 weeks that you're not seeing them. The other important thing I recommend to everybody is keep track of people's weight, because you're going to have clients who are going to think that they're going to be able to do this, go home, eat whatever they want, not exercise, and still get great results. Then you're going to have that person come back, they're going to be 5 pounds heavier, and they're going to say, hey, this treatment didn't work for me, I still have the same gut, or my gut got bigger. So if you're tracking the weight, you kind of know that they're not doing what they're supposed to be doing at home, and you could hold them liable for that, because while this is a great machine for aesthetic purposes, it doesn't cause a significant amount of weight loss. So if they're gaining weight, it's on them, and if they're losing a significant amount of weight, it's also on them. Other pre-treatment things I take a look at is bony landmarks. So I don't want to treat over any bony landmarks because, once again, we're very superficial. It's going to heat up that bone and cause a significant amount of discomfort. So if I have a patient where I can't easily see my landmarks, I'll take a little marker and just kind of mark everything off, ribs, the hip. With her, I could easily see, so I didn't need to mark anything off. But it's a safety thing for you just to make sure that you're not going to be hurting anybody, causing any discomfort, because if they feel that discomfort, they move, the probe gets lifted up, then all of a sudden they have a burn, and then it's a liability aspect from there. Along with that, like I said, you always want to watch the patient's response, because they're going to learn quickly that the scan, however many scans they get, it's going to show how good their results are. So you want to make sure that they're not toughing it out. So I always face the machine, so the machine is right next to me. I can monitor the patient's response, see if they're kind of wincing in pain, and just be wary of that, because I don't want to hurt anybody, don't want to burn anybody.
That probably ties into a question that's coming in. So a lot of the tech companies are moving to a hands-free model. Is the handpiece heavy? And do you believe a hands-free device is better the business move over having the provider in the room?
The handpiece isn't heavy. It's maybe 3 or 4 pounds. I'm easily moving around, no problem with, without any issue. It's very ergonomic. It has a great handpiece. I'll show you after this scan. It's easy to hold. It fits right in your hand. It's, doesn't need a lot of support when you're resting on the skin, just a little bit of pressure. Most of the weight is here because this area is filled with water. There's really not much here. I just keep the cord here, just give myself a little slack so I'm not pulling and lifting anything up. But yeah, it's very easy to move, very light, very comfortable. Longer positioning, patient position is going to be very important as well, because you want to get the most area that you could treat. So if I'm treating an abdomen, I like to have the client either lying flat or up about 20 degrees. It gives me a nice open abdomen. Nothing is crunched, and so I could get the most surface area treated. Love handles is another popular area to treat. For that, you want to make sure you have as much area to treat. As much fact, you're going to be very close to that hip bone. So you want to make sure the client is either prone or straddling the chair. Once again, you want them to be comfortable. If they're prone, you could always put a pillow under the hips to kind of give some more extension and give some more area to treat. Brow rolls and triceps, I always try to keep them prone with their arms at their side. Legs and glutes, you could either have them seated, prone, or sideline, depending on which area of the leg you're treating. Once again, it's your comfort, client's comfort, and how you're going to get the most surface area treated safely. So just
another question, Dr. Mike. Most of the other bulk heating technologies have utilized a glide technique to avoid pain, but can limit results due to an unpredictable thermal absorption. Are you sliding the handpiece? I'm
not. I am lifting the handpiece each time, because it lets me assure that the skin is moist and I get my 50% overlap. And how the machine works, I'll show you once again when everything is done. It's just a cellophane window, and the probe kind of just goes down sequentially in each area. So you're getting even distribution throughout the entire skin, depending on the area you're treated. And that 50% overlap makes sure that you're getting plenty of treatment in that area. So
Perfect.
A little bit about treatment, a lot of it which I covered before. Spray the entire abdomen, make sure the area that you're going to treat is wet, because that causes the best contact. One scan, like I said, takes about 50 seconds or so. I always start the clients on a low level, usually around level 6, just to make sure the comfort level is there, they're not causing any type of discomfort. Most clients I get to a level 9 to 12 and 1 to 2 stacks. Like I said, the stacks are sequential scans that go without doing anything. The other thing I do is, for example, women usually have a higher density of fat in the lower abdomen. So I might start at a level 9 in the upper abdomen and increase my level to 11 or 12 when I get to the lower abdomen, because I have more surface area that I'm treating. There's more thickness there. Chris, was there another question?
Yes, there was. I missed this one from a little earlier. Is the protocol in terms of treatments once a week for 3 sessions?
So they recommend one treatment every 3 to 6 weeks. You have to remember, even though you are getting the immediate results, it is still going to take some time for the body to clear away the dead cells. You want to give it time to do that. So I've been telling people to come back every 4 weeks, and I've been getting pretty good results with that. It's all going to depend on your patient population, their schedule, what are they doing in the off time. A little bit later, I'll talk about how to integrate this into the practice and how I'm making sure to keep clients coming in, even if they're not getting LIPOcel, to kind of keep an eye on them and making sure that they are doing the right thing when they're not here and not cheating on the diet and eating things that they shouldn't be eating. So next thing is your measurements. Your measurements are going to be important because people want to see a change when they get treated. If you read the studies that were done in Australia when this product came out, they are seeing a drop in one dress size per client. They are seeing 20 to 40% decrease in body fat after a series of 3 treatments. Once again, these measurements and keeping the weight are going to be your key to monitoring and making sure they are getting the results they should be. You could do your skin fold body fat testing. You could do your bioimpedance. I haven't implemented any of that yet, but it's just other options to really keep in mind if you really want to monitor your patient. One thing with your measurements is your reproducibility. So you want to make sure that either the same person is doing the measurements each time or that you're measuring in the same place. So on the slide that's on the screen, for an abdomen, I measure in 2 to 3 places. I measure at the level of the navel, which is always my first one. I measure at the level just below the ribs, and then at the top of the iliac crest. Those are easily identifiable landmarks, so no matter who's measuring, they're getting pretty similar results. And for me, it's getting good results for the treatment because here's the one area, the top area we're treating is right below the ribs. Around the navel is giving you the entire circumference, and then the area for women, the lower abdomen, is getting right at the level of the iliac crest. So you're getting a good gauge of everywhere and seeing a good change with that. The other big thing, like I said, is your photos. Your photos are going to be your visual record showing patients that, yes, they are getting a difference. On the next slide, I actually have a setup of the photo area that I have here. If you read the studies that dermatologists, plastic surgeons have done on photo taking, they all recommend this color blue background because there's nothing on the human skin that is really close to that color. So you're not going to have any interference, no blurring of the image with the backgrounds. Your lighting is also important. You want to make sure that you have good lighting, but you also want to make sure your lighting is not going to impede or change the way any of the natural curves look on the body. Your floor markers are another thing. You want to know that the patient is standing in the same position each time. This goes back to the reproducibility again. So for my mat, I have very simply where the footprints should be. They are forward facing, they have leftward, rightward facing, as well as 45-degree facing. I place my camera in the same area every single time. Chris, if you click over to the next slide. So on the left, you could see where my foot pads are, so easily to identify for everyone that's there. And then the next picture is where I keep everything. So I have it taped to the floor so it doesn't move at all. I have the little black pieces of tape show where I place my camera, and then the client stands in the same place each time, so I know I'm getting the same pictures. Because as you know, if you zoom the camera differently, position the camera differently, you are going to get different pictures, no matter if it's the same treatment or if it's different treatments. So once again, you want that reproducibility, good pictures, good results, and be able to keep a good, honest track throughout your treatment.
Just picking up on something, Dr. Mike, I'm just going back. What was the scan time that you sort of said earlier? I picked up 50 seconds, but I think I may have misheard you. But what's the sort of the scan time?
It's rough. It's between 50 and 55 seconds. I haven't timed it exactly. It's 52, 53 seconds, somewhere within there. So when I talk about the treatment packages, I actually do my treatment packages by the hour because I figure each scan is taking about a minute. So 20 scans for one treatment is a 20-minute treatment. So that's a third that they're getting. So 3 treatments for an hour package that they're getting.
Okay.
So the other thing with pictures is I suggest using, if you're using either a phone or a regular camera, use a tripod, because you're going to, once again, get that camera in the same exact position, same height each time. If you're using zoom on the camera, always use the same zoom. For me, I'm about 30 some odd inches away from the center of the client. I keep my zoom on 2 times each picture, and it gives me the same area, same picture, same zoom each time. The client position is also important with your pictures. You want the client to be, once again, same position, but good positioning. If we could flip to the next slide, please. So arms crossed in front, because it levels everything out. The abdomen, good lighting, and then on the footprints. So forward facing, leftward facing, rightward facing. Your side profiles are definitely going to give you your best results for abdomen scans. If you're doing love handles, you will get a good result with the front facing. If you're doing bra rolls or the back, you're just going to have them facing backwards. You'll actually see a couple of pictures a little bit later on with some of the other positioning that I have. And then lastly, with kind of keeping track of everything, is once again your documentation, especially if you have different nurses or PAs working with you. You want to make sure that they know which settings you used each time, where you treated, how many scans you treated, and then once again your weight, your measurements. You want all that documented. So if somebody comes in and says, "Hey, I lost my results," you can show them, well, last time you were 110 pounds, this time you're 115 pounds. So it's not the it's not the treatment, it's your habit. So going back to the question before about hands-free technology, once again, this gives great results. So you want to keep in patients' ears about eating right, exercising. Benefit of having the 20 minutes with the patient is you're in their ear. You're talking about diet, you're talking about exercise. From a sales standpoint, you're talking about other things that they might want to address on their body. Once you take care of somebody's main concern, they start to notice other things on their body. Somebody might have a big birthmark on their face that they don't really pay attention to because they're so concerned about how their abdomen looks. So you're on your second treatment, their abdomen's looking better, they're starting to look at other parts of their body. That 20, 30 minutes you're spending with them is giving you time to address these other concerns and talk about other treatment options. So it's not waste time. I think it's actually extra time that you're getting to spend, when it's not COVID going around. Everyone wants to have that interaction, that talk, that time with their doctor, being able to ask questions and get their answers and figure out what's going on. And then your expected results. So I touched on this a little bit before. So from my treatments, I'm getting roughly a 1 to 2 centimeter decrease in abdominal circumference around the navel with each treatment. I'm seeing visual treatments. These both are pictures of immediately before and after. So the woman on the right, the top picture is before, the bottom picture is after I treated her tricep area. Well, with the machine, I did 3 to 4 scans on each area. So took a matter of minutes, and those are the results she got immediately before and after. On the right is another woman I treated. I treated her abdomen, as you can see, immediately before and after. She was one, she's a very fit person, but after having 3 kids, she was never able to lose that baby weight. But she walked out of there telling me that her pants fit differently. Once again, going back to reproducibility, my camera's in the same position, they're in the same position. So the picture isn't skewed by a different zoom or a different position. You're getting honest, true results with your photos.
Just coming in with another question. Just want a confirmation. So no ultrasound gel required? Question mark.
Nope, no ultrasound gel, just water to make sure you have good contact through the treatment. It's just plain distilled water. Yeah, it's very simple, very, very basic.
Thank you.
Yeah. Let's go to the next slide. So another female I treated, her abdomen, she was another 20 scans. And I will admit that when I first heard about the results, first saw the pictures, I was a little bit skeptical as well. The picture on the right is actually me immediately before and after when we did our training on the machine. So I did see a difference. I did see a change in my circumference, and the results did stay with me. You have to remember, they're not just getting these immediate results. You're getting continuous clearing of all the debris, all the cells for up to 12 weeks. So they're going to continue to lose circumference, change in their diameter, their measurements, and the way their clothes fit through their treatments. Another area we could treat, which I think I have it. One more slide, Chris. No, another area we could treat, I had on an earlier slide, I'll have it later as well, is males with gynecomastia, with the breast tissue. You could do a treatment, and it's 5 to 6 shots on each breast, and they will see a difference or reduction in that breast tissue. For men who suffer from that, going to the beach, going to the pool, the summer in general could be a very stressful time. So it's, helping them gain that confidence back, helping them feel better, which if you start to make them feel better, they're starting to do more things to take care of themselves. I had a woman who I treated her abdomen. She told me, hey, I finally see a result. I'm motivated now to start eating, to go back to the gym, to do the right thing because I finally see a change. The picture on the screen is actually a client I'm treating. She has been here for 2 treatments. She had gastric bypass surgery about 10 years ago. She lost 140 pounds, and then she plateaued. So you see the first 2 pictures are my before and afters of her first treatment. The other one in the middle is a week after her first treatment, and then I just did her second treatment on her about a week and a half ago, and that is her before and afters. So she's getting great results, even though she had dropped 140 pounds. She's plateaued. She's honest with me. She says, I'm working a lot. I'm not eating right. And she's actually on, she's going through fertility treatment right now. So she is on birth control and every other hormone in the world that is fighting against her when it comes to losing fat as well. So despite that, she's still seeing some pretty good results. So another question I get when I speak to people is, how do I integrate this into my practice? Like I said before, you're looking at 20 to 30-minute treatments every 3 to 6 weeks. If you're stacking, you're going to have 40 to an hour treatments. Breaking down the cost of the machine, the only disposable is the handpiece. The tip of the handpiece. The cost of that cartridge is $5,900. There's 2 options for it. You could either choose the tip that is good for 3,000 scans, or the unlimited scans for 6 months. So depending on how much you're using it, you make that choice. If you opt for the 3,000 scan tip, you're looking at $1.97 per scan. So a $20, 20 scan treatment is costing you $40 out of pocket, and you're charging, if you're charging, I charge $1,900 for an hour treatment. So your profit margin is pretty good on that. Another thing I like to do, this is a great standalone treatment. You'll see the before and afters, but I do like to pair this with other body contouring. I have radio frequency body contouring as well as electromuscular stimulation. I like to make it so that patient will come in 1 week for their LIPOcel treatment. The next 2 weeks, they'll either come in for the radio frequency or the muscle stimulation treatment. It gives me an opportunity to keep an eye on them, answer any questions, and make sure that their weight is staying where it should be, that they're eating right, exercising right. So it allows me to keep a close eye on them. But they're also getting a little bit extra too. They're getting some better results, more skin tightening, muscle toning. So it's good for them as well. Another great thing is if you're doing medically prescribed diet and exercise program, another great thing to pair up. I actually spoke with the bariatric surgeon. I believe he was from Texas, and he's using this for some of his bariatric patients. Just like the woman I showed you, she lost 140 pounds and then she plateaued. To be able to give them that little bit of extra that might get them back on course to motivate them, it definitely does help. And then for your reputation as well as a weight loss provider, you're getting great results even at, months after your original surgery if you're doing the surgeries.
So I have another question coming in. So just I'll read it verbatim. So so we're clear, you're seeing immediate results.
Yes, immediate. Yep. So like I said, we took pictures just before we started the treatment here. Chris is going to go and speak a little bit after I finish up here. We're going to go take some pictures, and then I will show you the side-by-side before and afters that we had. I'll do some other measurements, so you'll get to see firsthand, what the treatment does and how the results come out. So like I said, my approach with the device is pairing it with other treatments, allows me to stay in their ears. I can't stress it enough, is keeping the patient accountable, keeping your measurements, keeping your weight, making sure if they're really having trouble, keep a diet log and exercise log, so you don't have those clients spreading bad words saying this treatment doesn't work. It's just it's a sham. You want to make sure that they're following, they're doing their part too. But it's easy to integrate. I've talked to primary care practices that are easily integrating it. If you're doing a patient interview for something else, you could double up, do the treatment as well as your interview. It's great in aesthetics practice. Really, it fits if you're a plastic surgeon. People don't nowadays, especially with everything going on in the hospitals, people don't want to go in for surgeries. They don't want to go under anesthesia. This is a great option, or a great bridge after plastic surgery to kind of touch up those little areas. Another question I get is, what's the difference between this and a cool sculpting device? Cool sculpting will cause freezing of the cells and some apoptosis. but not all the cells die. The downtime is a little bit long because you do have the vacuum damage from the machine itself. You're having the inflammation, erythema, much more discomfort with that treatment. You saw Liz, she barely flinched the entire time. She might have fallen asleep a couple times, I'm not sure. But you know, it's comfortable compared to cool sculpting. It's better results than cool sculpting. It's more comfortable than cool sculpting. The only difference is, you know, the hands-free versus the, you know, having to manually operate it. But for the results you're getting, the 20, 30 minutes you're spending, is well worth the time that you're spending with the client. So yeah, any other questions? Anything else?
So, so what we're going to do now is, if there are more questions, please continue to send them through. Dr. Mike is now going to sort of take the after photos. He's then going to sort of create a before and after, so we can show you that in real time in about 5-10 minutes. So thank you, Dr. Mike. I'll let you go and do the before and afters, and then I'm just going to talk a little bit more about the MD Power Program. So as I said, I'm the VP of Customer Success for MD360. There's two parts to this. There's the technology, and I think what we've seen is MD360 and the LIPOcel is gold standard in technology. But the other part to any decision in terms of buying the technology is sort of how do we implement it, and how do we, you know, make money from that whilst treating our patients. And so that's where the MD Power Program comes in, and I'm just going to spend 5-10 minutes talking through that whilst Dr. Mike does the before and afters. So the premise from my starting point, so I run a company called Sales MD, but as I say, part of the MD Power Program. And my background has always been in sort of sales, and one of the quotes I often talk about is the relationship that you have with the customer is the one thing that your competitor cannot copy. And what I mean by that is, if you think about your practice, you know, people can buy the same technologies, and so what differentiates you, what gives you competitive advantage over other practices, over any competitor, and that's the relationship that you have. And so when I think about sales within a medical practice, I think about ethical sales, and in my mind, the doctor, the provider, always has the final decision. But this is a cash business, and so if the patient is an ideal candidate, our job as a practice is to ensure that they purchase the treatment from us and not from someone else. And that's kind of where I come in as part of the MD Power Program. So these are real conversations as I've attended some of the shows pre-COVID, as I've spoken to many doctors. These are conversations that I've had with doctors. I've spent $600,000 on devices and they're collecting dust. One recently was I bought a device for $500,000 and they've done, you know, 7 treatments in 5 months. You know, buying technology on its own isn't going to be, you know, the answer, and sometimes it's sold as, you know, buy this and suddenly your practice is going to, you know, quadruple in revenue. The reality is the technology is the enabler. We've still got to do the marketing. We've got to do, you know, the sales, the conversion of those leads into patients. We've got to put the processes in place such we can grow the practice. So adding a device is one part of the equation, and it's the other pieces that, you know, the MD Power Program really take care of in terms of maximizing this investment in this technology. These aren't comments that we've had as from our clients, but they are certainly comments that, you know, I think we've all heard. And of course, I think it, you know, I bring this up because I think it's important to put it out there. You've probably spoken to other doctors that are saying similar things to this, and I recognize it, we recognize it, and the MD Power Program is to ensure that, you know, you're not saying this about one of our devices. So what is the MD Power program? And clearly, I'm not going to go through everything here, but there are 6 pillars to success. And we bring what we need to bring of these pillars. So when you do purchase a device, we work with you to determine what are the elements that you need. We might build out a brand new website for you. We might sort of look at what your social media is doing. We build in some money in terms of Google Ads. So I think people recognize that search engine optimization, i.e. people finding your website organically, is really important. But the day you buy a device and we put that information on your website, it's going to take 3-4 months before you start to rank for body contouring, for example. And so we use Google Ads as part of our program for you to sort of close that gap so we can start driving leads into the practice. Where I really get involved is how do I help you turn those leads into consultations, and ultimately from consultations into patients. So I bring staff training and education, a look in terms of lead conversion. So we run an appointment setting program as well. So we'll actually have a team of people taking the leads. I'm going to talk about that in a little while. We can look at the branding of the website. We can look at consultation training and sales training, again, something that we offer. As a business consultant, I'm looking at your practice tactically and strategically. And what I mean by that is, when you buy the device, you want to start making money immediately from that device. So when the payments are due for the lease, which is the typical way you guys buy these devices, you're not out of pocket. So I'm very tactical with you and build that program that starts driving that short-term revenue into your practice for this device. But as a business consultant, and having worked with a lot of organizations over the last 20 years of my consulting career, I'm looking to build the foundations for something that can grow and be sort of hugely valuable to you. So again, when we first engage in terms of the MD Power program, we're looking at these 6 pillars. We bring to the party the elements that we need that are going to really help you to be successful. And so this isn't just a technology sell. You're not just buying a bit of technology and we leave you to it. And we're certainly not going to sort of be, giving you a little wash and a wax in terms of these as, pretending that we're going to do some stuff and then not actually deliver. We put this program in place to really sort of hold your hand. And typically I'm involved with you and the practice for, sort of 9 to 12 months as we sort of implement this journey together. So what does that look like? This is part of a 90-day implementation plan, and I'm just going to show you the first 4 weeks. And I just want to sort of share that just from a point of view in terms of sort of the level of detail we get into. As I say, these will change based on your specifics, but there's lead generation, which is marketing, and lead conversion, which is sales. And sometimes we get het up or concerned with the word sales, especially in the medical environment. But in real terms, we've got to get people in the front door. That's marketing. As soon as we have that telephone call, that then starts the sales process. And so very quickly, we've got to sort of implement those pieces. So if I looked at this as a sort of standard first 4 weeks of the 90-day plan, I'll be working with you. If COVID allows, I'll be face-to-face for a day and a half in the practice, really understanding the practice, really understanding what your goals are, what your expectations are, what is it you want to achieve within the practice by adding a device into the mix. And then on the marketing side, we need to look at your website. What are the requirements? How do we add the new treatments? Do we need to look at Google, Yelp, other external websites? So that starts to happen. And then I'm starting to look at it from, okay, when the phone rings, what do we do? How do we manage the processes? What are they set up well? And especially if for practices adding aesthetic treatments, there are differences, and we need to sort of think through what those are and implement those. And we start the basic phone skills training, implement the intake forms, etc. And so by week 3, we're now starting to, build out the website. There'll be a website mock-up, and even by week 3, we're probably faster than this, and we're probably starting to go live with a website, and certainly starting to drive the ads, as I mentioned, to start driving traffic as quick as possible. And so again, you can sort of see, email marketing happens. I'm working in terms of the processes, training, and all of those things. And at the end of sort of that first sort of 4 weeks, we evaluate the first 30 days. My role is to ensure, again, as the VP of Customer Success, is we're doing what we need to be doing to support you in terms of growing this practice, growing this part of your practice, and sort of bringing the weight of all of our services, those 6 pillars, to your practice as and how and when we can. So just a little bit of what does that look like in terms of when I'm involved. For me, there's sort of 3 elements. I said I'm involved for 9 to 12 months. I'm not stopping this. It's not linear. I'm looking at the practice constantly. I'm running the reports. We're driving the volume of traffic, etc., etc. So that's the consulting piece. I wrap around training. So I'm always training and coaching the team in terms of the skills. I know, having been a corporate sales trainer, for 20 years now, that I could come in and do a 1-day sales training. The team would love it. I know how to make them happy with training, but it's not going to change the results, because it tails off. All training tails off. We've got to implement it. We've got to coach around it, and hence the reason I'm involved for nearly a year, because I'm going to be talking about how we do best practice consultations. How do we have that ethical sales conversation? How do we ask really impactful questions when we get the objection, when we hear the no, or which is more often, I need to go and talk to my partner, or I need to go and check my kids' schedule and when I can drop them off. All of that is an objection. How do we handle that? How do we tell stories as part of that process? And then one thing that's really important is, how do we master the mindset? And again, I'm spending a lot of time around mastering mindset right now, with sort of stay-at-home orders in some states sort of on the rise. Is the glass half full or half empty? And so that mindset, that mind game, is such an important element, and I coach and train around that all the time. And so we're constantly going around this sort of loop in terms of, ensuring the team are fully up to speed and totally prepared for every opportunity that comes in. The other thing we do, and is part of the MD program, and again, we work out what works for you, is we actually can take the lead. So if we have a web team, which I mentioned we do, and they're generating leads for LIPOcel and body contouring, rather than the lead coming into your team, and that's more workload on everyone within the practice, that lead can actually come straight to us. And we then nurture, we qualify, and we book patients straight into your schedule for consults. And when we do that, we hand it over. So we're not just booking an appointment. We're understanding. We're that first part of the practice. So we talk about authentic contact. We like to see ourselves as an extension of your team. And we don't represent, we're not saying, hey, we're from Sales MD, we're from your practice. I often hear the comment from patients that we're booking, will I be meeting you when I come in? And that's the relationship that we or my team build. And whilst they won't be meeting us, we make sure that we hand over the baton very smoothly to your team, such that, you know, I know you spoke with Samantha on the other day on the phone. She mentioned that you were interested in this, and this, and we pick it up from that point onwards. So that's kind of where we sort of have that authentic contact. We drive more of those appointments to consultations without you having to be involved, and we report on everything we're doing, so you have total clarity of you know, this whole process. So just to summarize, I'm starting to see the before and afters coming in, so I'm going to shortly hand back. What we deliver: best-in-class consultations, ethical sales skills. We're enhancing patient satisfaction, and ultimately we're looking to increase the conversion rate. That's how we help you implement a new piece of technology. And on the whole, the MD Power program increases, you know, conversion rates to sort of 75% plus, and that drives sort of your multiple six-figure, seven-figure practice, which is, you know, no longer just purchasing a piece of technology. You're purchasing a whole philosophy to sort of drive the results that you're ultimately looking for. So I'll take any questions, but let's also get Dr. Mike back on board. So are you there, Dr. Mike?
Chris, I'm just fixing up the pictures, putting them side to side, and just give me a couple minutes. I'll get them over to you to put up for everyone.
Okay, perfect. So if there are any questions on the MD Power program? So one of the questions just coming in: what are some of the biggest challenges that I face coaching a front office staff? That's a great question. Firstly, my belief is that people that sort of work in your practice truly care about the patients. They joined this industry to be part of this industry, and they want to be within this environment. So the starting point is they're typically enthusiastic about it. The challenge comes is that they don't want to necessarily sell. And that's in a way the biggest challenge, because they're part of a sales process. It is a cash business, and we need to recognize that everyone from, you know, the front desk all the way through to the surgeon, the provider, is part of that sales process. And it's about making it really streamlined. And so the first thing I do in any engagement is to sort of change how we think about sales, and really sort of change our minds in terms of in terms of what sales is. Sales is about being of service. It's about truly understanding the emotional drivers as well as the physical attributes that a patient wants to see and experience. So it's really important that, you know, we really truly understand what is important to the patient. If we care, and my experience of the staff within a medical practice is they do care, then sales is no longer feared. It's now starts to be embraced. Because what is sales? What we sometimes perceive sales is that slick salesperson that's selling you something that is that they don't want. that's not sales. You know, let's change that. That's not sales. Sales is about fully understanding their wants and their needs, what's important to them, and matching the services that you offer to them as an individual. And it's marrying those two pieces. That's the sales process. It's sales process, sorry. So what that means is, to really understand, we have to ask a lot of questions. We have to listen. We have to really engage with the patient. And as I say that, a lot of practices straight away say, we do that. And the reality is you do, but you do it with one or two questions. And when I get involved, we really start to build that relationship. It comes back to the only thing that your competitor cannot copy is the relationship you have. The quickest way of building that relationship is by asking questions. It's about understanding what's important to them. And so I think I've answered this in a very long way, but I think it's really important to sort of start to understand that sales is your friend. It's the enabler to, you know, massive success, and really understanding what's important to them. Another question coming through is, can you coach a staff member to be a salesperson, or do you need to hire a salesperson? We're on a tight budget, and we need to utilize the staff we have to get the cash flow we desire. This is a great question. I've been in sales 35 years, and I remember my first sales job was with IBM, and my first multi-million-dollar deal was with the company Del Monte. If you recognize that name, they do pineapples. And the chief information officer, I'm selling IBM technology, so I'm dealing with the CIO. And she turned around to me and she said, Chris, you're not the best IBM salesperson I've ever had, but you are the most honest. And this was a very competitive situation. So I was there with IBM, you know, Compaq were there. If you remember Hewlett Packard, they were there. Dell, everyone was there competing, and I won the business. And at the time I was 26, and I remember being told I'm not the best salesperson, but I am the most honest. And it, at the time, it sort of upset me that I'm not a very good salesperson. Even though I'd won the multi-million-dollar deal, I was still upset that I was told this. And then I look back now and I think, actually, it's about being authentic. It's about being honest. And so, yes, you can train the skills because it is a process. And if I think back to when I was 26, I had sort of the honesty, the integrity, the authenticity. I just didn't have a very good process. But over the next period, when I went through IBM Sales School, I developed those skills, and I was able to then ask better questions, listen more intently, understand fully what they were looking for, and then align that with the solution. And that's what sales is. So they can be taught. And again, back to my previous answer, for me, it's about changing that mindset to what people think sales is. If we think of ourselves as, you know, all those attributes we don't like in salespeople, then it's very hard. If we change it to being of service, then we can certainly build those skills. And again, it's really important that we do that, because this is a cash business. As I say, medicine wins. So it's not a case of selling them because we can. It's a case of, have we got a treatment that's going to meet their requirements? If the answer to that medically is yes, then we need to maximize every single one of those opportunities. And we do that as part of that sales process. And just to, again, everyone is involved. Everyone is part of this. And the reason I say this is because I remember mystery shopping a practice, and I was asked a question by the patient care coordinator. I then was in the room with the nurse. I was asked the same question. I then sat down with the surgeon. he asked me the same question, and then what that meant, I then had this feeling that this wasn't coordinated. And so it's not just about learning how to do it, it's about coordinating the process between all of these people, so it's slick and people are feeling confident, competent in terms of making the decision to purchase from you. I'm getting a message that I believe the slide is ready. So Dr. Mike, is that the case? I think I've seen an email come in, so I'm going to show the before and afters. Are you there, Dr. Mike, and are you on the screen?
Yep, I'm here. So hopefully you got the email. I was able to put the pictures that we took before treatment and then the pictures that we just took.
Perfect.
Side by side, and we'll talk through them a little bit. Going along with what Chris was saying, like I said before, I was one of the first to sign on to the MD Power program. And I had a question come to me yesterday from another clinic, and they said to me, you know, every company says, you know, oh yeah, we're going to partner with you, we're going to be there step by step. And most of the companies, it's, you know, they're there if you call them and you need something. So they want to know what the difference was, and there is a difference. Every week, you know, every Tuesday at 2 p.m., Chris and I, we meet, we talk, we go over, you know, what my sales for the week were, what we're working on. We have a plan going forward for, you know, what we're focusing on each week. You know, any events, any promotions. I was one of the ones, they rebuilt my entire website. So we are on Slack together. I have a Slack where I can talk with Chris and myself. There's another chat room where it's myself, Chris, and the entire web team. So, you know, I'm giving them pictures, we're brainstorming back and forth, putting up content, taking down content. But Chris brings, you know, like you said, 35, 36 years of experience to the table that most people don't have. You know, he's going over, you know, sales calls that I do, going over situations, you know, seeing how I work with things. Another big service that they have also is that, you know, people who might have, you know, come through the website or who have called that I wasn't able to close or wasn't able to get in for an appointment, his team will take that list and they will call them. They will, you know, at least get an extra 1 to 2 appointments out of that list. So if you have 10 clients calling you in a week, you're able to schedule 2 of them. You know, that's great, but they might be able to schedule another 2 or 3 of them. So you've pretty much just doubled your opportunity of, you know, closing a deal. And when they're talking to them, they are pretty much already pre-vetted, they're pre-screened, so they're quality people who are coming in. It's not just, you know, hey, we were able to get somebody in. You know, we were able to get somebody in, talk to them about what they wanted. Here's their background and information, and you know, you kind of just, here's the ball, just cross the line. You're done. You're good to go. You know, same with Elijah. Both Chris and Elijah have both been out to my clinic in New Jersey. They're both on the West Coast. They've been out here. So, you know, they're here, they're working together. I talk to Elijah all the time as well. You know, he's always a phone call away. You know, he is like me. He is about selling results, not selling a product, which is a good feeling in this field because, as everybody knows who's dealt with any of these, you know, companies, they want to sell you something and then, you know, they don't care until they are ready to buy something else. So having somebody there to, you know, bounce ideas off, talk to, you know, it's a good extra benefit that you really don't find anywhere else.
No, I think that was a good summary. So thank you, Dr. Mike, for that. So I have the before and afters. So let me bring that up onto the screen, and perhaps then you can talk through. This is the first of 3 slides. Is that showing? It shows. Is that coming through?
Yeah, I think we're coming up now. So yeah, like I said, we did our measurements before. So our measurements at the navel her circumference was 75 centimeters before we started at the navel. Afterwards, we were at 73 centimeters, so we had a 2 centimeter change there. Right below the rib cage, we started at 78 centimeters, and at the end, we were down to 76.5, so a 1.5 centimeter change. I don't know any other treatment besides, you know, something surgically invasive where you're going to get that type of results. This picture here on her left side, you know, once again, I pointed out reproducibility. It looks like she's in the same position that she did not move. But you see the difference, especially in the upper abdomen area. You see more of a curvature on the right than on the left. There we go. You know, each view will show you a little something different. In the front view, you know, I haven't really seen a great front view picture unless I'm treating love handles. The side views are always my best. But if we go to the last slide. You see a nice difference here in both, the upper and lower abdomen. The curvature is different, reduction in size. And yeah, she, like I said, she was sitting there for 20, 30 minutes, and she's going to see a change, and that change is going to keep going.
Good. So there we have the before and afters. Any sort of final comments, Dr. Mike?
No, I mean, like I said, when I first started, I didn't have a following beforehand. I started this business during COVID. I bought this machine last, and now I'm suffering through COVID. And this machine has, been great for me to have. And just having Chris and Elijah in the background has been great, because especially nowadays with everything being shut down, it's very easy to get discouraged, very easy to get stressed out. So it's good to have that outside mind of people who have been through it. They've been through the ups and downs to kind of, guide you through. I mean, Chris has been in sales longer than I've been alive, but
don't say that.
It's great to have. It's a great support team, and and I'm also always available too. As part of the team, we're always brainstorming of ways that we as a team can bring something together to help everybody's practice. Workshops or ideas to maybe do a webinar for how to combine treatments, how to bring these things in your practice, how to make the most of whatever machines you have. It combine everything, things that are time consuming, that if you could have somebody kind of lay out the framework, become a lot easier and a lot quicker for you to do. So it's like I said, it's an entire group of people you get working with everybody, and I'm extremely happy that I've gotten to work with everyone.
Good. So all that's left for me to say is, firstly, thank you so much to Dr. Mike Ellis for your time this evening, and giving us such a phenomenal live demonstration, and to your model for being here. So thank you very much. Thank you to everyone that's joined. I hope that's really sort of given you a good insight into the LIPOcel and body contouring and what we do, as well as the MD Power program. All that's really left for me to do is wish you happy holidays, and if there are any questions or comments or thoughts or anything, please feel free to reach out to any one of us, Elijah, his team, Dr. Mike, or myself. So thank you all very much for joining, and I wish you a very good evening wherever you are. Thank you.